There's a burden on the caregiver in terms of, going through all the steps to get a CAR T-cell product. But when the CAR T-cell therapy works, it can be amazing, and patients like the idea of it being one and done. Now, generally speaking, I don't think there will be a trial comparing head-to-head of CAR T-cell therapy versus bispecific antibody therapy. But just seeing the efficacy of CAR T-cell, I think if there was to be a head-to-head trial, I think the CAR T-cell therapy would probably come out ahead. So if I have a patient who, where you're thinking about one or the other, typically I would lean towards the CAR T-cell therapy, knowing the degree of efficacy. But on the other hand, I also appreciate that not everybody has access to CAR T-cell therapy because there are, as I mentioned earlier, the multiple layers that are involved in terms of you have to have access to a major medical center, and it's much more logistically complicated. And with that in mind, I think for many patients, bispecific antibodies can work incredibly well. And I think there's certain patient phenotypes where I think the bispecific antibody could be the best choice for the patient. And I can think of many examples where the bispecific antibodies, I think patients feel great on it and they can do remarkably well. But I think that, at the end of the day, it's pretty much tailored to the patient. So certainly I have these conversations come up all the time for patients I see. In some patients, I do recommend the CAR T-cell therapy. And then for other patients, I do recommend the bispecific antibodies. I think it'll be interesting to see as time moves forward, we'll have new bispecific antibodies that become available, as well as combinations. So I think that, will there be as much of a difference? Hard to say. I think at the end of the day, I think all these therapies, they're really moving the bar forward for patient outcomes.